Medications play an important role in the treatment of many health conditions. Current research shows that up to 90% of all people who are diagnosed with a mental illness are prescribed psychotropic medication. Medication management is a key role of mental health nursing. In order for the nurse to provide safe and quality care to the patient, appropriate information on the effect and administration of the drug is essential. The two main drugs that will be discussed today are antipsychotics and antidepressants. This presentation will discuss the action of the drug and how it works in the body, indications for use, route of administration, and side effects.
Hi Caroline, so what topic are we going to be discussing today?
Today I will be sharing some information about antipsychotics.
Interesting. That is a very good one. So my first question for you is, what are antipsychotics?
Antipsychotic drugs, also referred to as neuropleptic, have the ability to treat people with schizophrenia, schizoaffective disorder, and some forms of bipolar.
Would you like to explain how this drug works?
Antipsychotics work by restoring the natural chemical in the brain's chemistry back to balance. These chemicals are called neurotransmitters. Neurotransmitters allow communication between nerve cells. All antipsychotics reduce the action of the neurotransmitter dopamine. Too much dopamine in the brain can lead to symptoms of a psychosis, including hallucinations, delusions, and distorted thinking.
I would like to know what is the purpose of this drug. So, in what conditions do people use this drug?
For someone suffering from a psychosis, their reality is often impaired. A psychotic episode can include hallucinations, delusions, and thought disturbances. The purpose of antipsychotic medication is to reduce these symptoms so the patient can continue life as before. However, it is important to remember that antipsychotic medication does not cure the illness, but instead has the ability to weaken the symptoms. Antipsychotic medications are most commonly used for the treatment of schizophrenia and other major psychotic disorders.
Is there any side effects associated with this drug?
Like all drugs, antipsychotics also come with unwanted side effects. Most side effects of antipsychotic medications are mild. The most common side effects include drowsiness, weight gain, rapid heartbeat, a drop in blood pressure when standing up, which can cause dizziness, stiffness, or trembling in muscles. There are two types of antipsychotic medications, atypical and typical. Atypical are newer antipsychotics, and typical refers to the earlier antipsychotics used. Atypical medication side effects include head nausea, blurred vision, and photosensitivity, whereas typical antipsychotics are known to produce extrapyramidal symptoms. Extrapyramidal symptoms cause movement and muscle control problems throughout the body. Extrapyramidal side effects include akathisia, dystonia, tardive dyskinesia, photosensitivity, and neuroleptic malignant syndrome. While both are effective, the atypical medications have advantages over the typical ones. Although atypical antipsychotic medications are more commonly used, for some people, typical medications suit them best. However, if symptoms persist, it is recommended that the patient talks to their doctor in order to either change the dose of medication, ask to be prescribed another medication, or change the time of day that their medication is taken.
Lastly, I would like to ask you how this drug is being administered.
Antipsychotics are available as tablets, capsule, and liquid medication. In some cases, a D-port injection is used. A D-port is a long-acting injectable antipsychotic medication, commonly used for patients with schizophrenia who relapse due to non-adherence with antipsychotic medications. Unlike taking a tablet daily, an in-port injection is slowly released into the body, given at 2 to 4 week intervals. So Cassandra, would you like to get started on your topic?
Yes, thank you. So I will be talking about antidepressants today.
That sounds like an interesting topic. So, how does this drug work?
Yes, the antidepressant drug itself have different mechanisms from one to another depending on their chemical structure and pituitative mechanism action. Nevertheless, in common, these drugs prevent the uptake of noradrenaline and serotonin, also marked anticholinergic and sedative effects.
And in what conditions is this drug used?
So, this drug is commonly used to treat depression. On the other hand, it can be used for anxiety disorder, obsessive compulsive disorder, which is also known as OCD, panic disorder, serious phobias such as agoraphobia and social phobia, bulimia, and post traumatic stress disorder, which is also known as PTSD for short form.
Thank you. It's very interesting to know that antidepressants are used to treat a wide range of disorders. How does this drug get administered?
Now, this type of drugs comes in different dosages, starting from 10 milligrams to 100 milligrams on general. This drug is usually administered via mouth, so we'll be having tablets, capsules. If we can't administer it via mouth due to their cognitive impairment or something, it can be given via inhaled, intranasal, sublingual, transdermal, and rectal routes.
That's a good point to know. Last but not least, what are the major side effects of antidepressants?
So, talking about side effects, this drug actually can give you unpleasant side effects such as nausea, increased appetite, and which it will lead to weight gain, lots of sexual desires. Then again, it affects your relationships, insomnia, dry mouth, fatigue and drowsiness, and also blurred vision.
Thank you very much for sharing such a great amount of information with us today.
You're welcome, and thank you so much for giving me this opportunity to work along with you to put up this presentation very well. So, dear audience, to conclude, antipsychotics and antidepressants are drugs that are commonly used in treating mental disorders. Clearly, depression and schizophrenia are really complex disorders. Fortunately, medications like antidepressants and antipsychotics can help treat the core symptoms. Knowing how these drugs work and what effects they can have will be an important measure in using them properly and effectively. Thank you so much for joining us today. We hope you have a pleasant day. Thank you.